Hi, this is Dr. Tobe Moma, host of Health and Wellness with Dr. Tobe. It's an honor to ask you to watch our show this coming few weeks with Dr. Jennifer Floyd. I'm the president of Faith and Power Ministries, also a family physician at the University of Mississippi Medical Center. It's an honor to host a guest every week on our show. This week we have a special guest. Her name is Jennifer Floyd. She's an optometrist. She's the leader, the founder, and the chief executive of Visual Difference in Ruston, Louisiana. This young lady has started her own outfit almost for the last 13 years, married for 22 years, finished from Louisiana Tech, and she's been a resource for the optometrical society in this part of the country. She's going to be educating you on what it takes to be an optometrist, on why you should see an optometrist, on the benefits of Jesus even in the life of an optometrist. This is Dr. Tobe Moma telling you to watch our show. I approve this message. God bless you. Hi, this is Dr. Tobe Moma. What an honor, privilege for you to tune into this show, Health and Wellness with Dr. Tobe. It's an honor to have you on the show today. Don't touch that dial. We have a great show in store for you. Our guest today is Dr. Jennifer Floyd. She's a manager, owner, chief executive. She doesn't like to use those fancy words, but she's an optometrist who runs and owns a company called Visual Difference in Ruston, and we're going to put the address on the screen. And she's been sharing with us her background, her pedigree, her life story, and I know if you missed the last show, you need to get it. She poured her heart out on how she got where she got to and what God did for her getting to where she got to. Her marriage, her children, her Christian faith testimony. I want to emphasize today on entrepreneurial optometry. We don't have a lot of females in the field of optometry, Dr. Floyd. Am I correct? What's the the percentage? Is it a male-dominated field?
Well, it was.
Okay.
I mean, Dr. Tobe, but when I entered into optometry school, it was definitely male dominated. However, that is changing.
Okay.
And I did find that out. Like he said even 60-40.
Okay.
And actually, there's more Asian females
Oh, wow.
than any other right now.
Wow.
It's a growing profession for women, but yet it is still very
So
difficult.
in your class, it was male-dominated?
Yes, sir. Yes.
So you were how many in the graduating class?
118.
Wow. And how many females? Maybe about 20, 30?
Wow, gosh.
You can't guarantee,
Probably,
right?
Probably, yeah. I'd probably say
Okay.
45.
Right.
probably
So my
that.
question to you is, how do you successfully combine all that with being a mother and a wife? I mean, I don't want to disparage womanhood, but I know there's so many women who are just tired and busy just being a mother and a wife. We call it a housewife, and that's a full-time
Yes.
job on its own. But you are not just a housewife per se. You're also a manager. You're a optometrist running your own business. This is a field that, some people say the angels fear to tread, because you need to take out maybe financing, loans. You need to, make sure you build enough clientele and partnerships. And for some women, and I'm putting this out there, and I know you can elaborate further, by the time you go out building your business, it's hard to, you want people to know you for who you are, not for what they think you can offer them. Unfortunately, this happens a lot to the female folk. They come out with a good business proposal, and people are not thinking of the proposal, they're thinking of the person behind the proposal. Have you seen that happen at all in any of your business ideas or initiatives?
Yes, sir. It's very difficult. I mean, and how people perceive you
Mhm.
as being a mom, as a professional, it all plays a role. But I wanted to say that it was scary. It was very scary for me to go out on my own. I didn't do that actually at first. I had worked with a group of doctors and then worked in a hospital setting, and I did commercial optometry. But in my heart of hearts, in my heart of hearts, I just knew that I needed to. There was an urge. There was just something there saying, you've got to take this a step further and do it your way, or really do it my way through the Lord.
Right.
And I knew I had so much more to offer, and I felt very restricted when I was in a group, and I didn't like that.
Yeah, you told me a story about what a pastor told you. I want you to share with our audience because I thought it was a very inspiring. What the pastor told you when you were considering starting your own business.
Yes, it had been very difficult. I was in with a group, and I actually wanted to buy in, but I wasn't really getting paid enough to be able to even put money back to be able to start my own business. My CPA said, "You're never going to be able to open your own business what you're making right now," and that was the truth. And you have student loans coming out, you have things like that you're faced with, and I was like, okay, so what do I do? And so I kept approaching the group and saying I wanted to buy in, and they were like, okay, you can, but the money that they would require was more than I could even borrow, and it just kept getting more difficult and more difficult. And actually, someone else approached me about coming in, having my own practice. I could rent the building, but I wouldn't be able to sell glasses. But I could run my own show pretty much and set my own hours and do some other things. And I actually went to lunch with them, just went to lunch, and didn't agree to anything. And the other company group found out about it and approached me. And when they found out I did that, they pretty much kind of shut the door on me and told me that, you're not going to be able to come and practice this way anymore. They felt that I was making a deal behind their back, but I hadn't.
Right.
I hadn't done that. I got very, very upset. I called a pastor and I said, I don't know what to do. They've kind of changed the locks on the doors and told me that, I needed to pay to get my stuff out and some things like that. And I said, this is just not right. I said, I just had lunch with another person talking about bettering myself, starting my own business. I said, I never made an agreement. In fact, my mother had just died.
Wow.
I was 5 months pregnant with my second child, and we had just bought a brand new house. So, I mean, and a new vehicle. So, like, I didn't really have the finances, but those were things I needed,
Right.
and I was scared. I was really scared, and I said, I don't like change. I'm pretty consistent, and it was a lot of change happening in my life. And I called the pastor for guidance, and he said, it's kind of like baby eagles, I believe. He said, the mom makes the nest all nice and cozy and puts the down and the feathers in it. And he said, but when it's time for those babies to fly, that mother starts plucking out that down and removing those feathers. And there's thorns in the bottom. The sticks are there. And so the nest and the cushion is no longer there. And so the baby birds have to fly. And he said, sounds like it's time to fly.
Okay.
And I said, okay. He said, you must have faith.
Right.
You must have faith. These things are happening for a reason. And it's time for you to go into that other practice if you can.
And that's where visual difference came out to. That's how the origin of visual difference. That's amazing. But tell us how it's been since you went out on your own, which I think maybe 10 years ago. Oh.
I started the visual difference actually December 5th, 2005.
Okay, almost 13 years ago. Wow. So how has the Ruston market been? I know there's a lot of students and there's other, so you've been able to do what you were visioning when you
Yes.
opened?
Yes, and it was slow at first because even the space that I went into was very, very small, but it was something I could afford.
Okay.
It was very small. We could afford it. And I remember at that time it was me and one employee. And then I just kept growing. And I wound up outgrowing that space. And God was good. And just, I made that relationship with people. And I just wanted to let everyone know that I was there to help them, and I was going to do everything I could do. And from all my experiences with all of my eye problems growing up, I'd actually seen 23 eye doctors growing up.
Wow.
and was misdiagnosed and didn't find my true problem. So I've had a lot of experience sitting
Wow.
in the chair growing up. So I knew that I could use those experiences to
Mm,
help people, to really
okay.
help people. And it's just grown and grown. And I decided then I really wanted to be able to do it all. I wanted to sell the glasses. I wanted to do full scope optometry.
Hmm.
And there was an optometrist that had passed away that had a much larger business and building and was selling glasses. And his brother actually was a pharmacist in Arcadia. I grew up with them, knew
Oh,
them,
wow.
and they said, "We have a building. Are you interested?" It just kind of fell in my
Wow.
lap.
Praise God.
And it was. And I said, I am, but again, finances, things
Right.
like that. But I prayed about it, and I just knew. I just knew
Mm,
that that was what I was going to do. I had to take a leap of faith. And the market there in Ruston, we've just grown every year,
praise
still
God.
continuing to grow.
Wow, that's awesome. Now, a lot of my viewers are wondering what's the difference between an optician, an optometrist, and an ophthalmologist because they hear us use those words interchangeably, and you and I know they're not the same.
That's right.
So, who's an optician, who is an optometrist, and who's an ophthalmologist?
Very good. In my practice, I have a certified optician.
Okay.
And in certain states, they don't even have to be board certified. She is ABO certified, and she is the one that once I put the prescriptions in, she fills the prescription, almost like a pharmacist. She's going to go off the numbers that I put into the computer, and she is going to fit them. She's going to take the necessary measurements to ensure that the glasses are fitting appropriately. She's going to discuss lens options with them, tints, what they're going to be doing, if they're more on a computer, if they're more, on the cell phones. She's going to discuss all those things, take the necessary measurements, and then in our office we actually cut and edge the lenses. And
Okay.
so there, while you wait, sometimes, so we try to not have a very long period of time with people being
Hmm.
without their glasses if we can do that. But she's going to take all those measurements, and then she's going to verify that it was made correctly and adjust them to their face.
So, what
Okay.
does the optometrist do? Does he make the lenses, or does he? I know you also evaluate the eye, but I just want to know the optician. I mean, you're saying he or she makes sure that this lenses are the right power.
Yes, the
Okay,
power.
and then
And
what does the optometrist do?
we're going to thoroughly evaluate the entire visual pathway.
Okay.
And most people just think of, oh, that's checking visual acuity, reading the chart. I look at functional vision as well. How are they performing from start to finish? I'm
Okay.
asking tons of questions. We're getting a thorough medical history, whether they're diabetic, have any genetic problems in the family, macular degeneration history. We're going to evaluate everything. We're going to put the prescription in. Like I do not dilate before I check for the glasses, which is a very important step. Sometimes that will happen, but we're not going to do anything. We're going to check it, check the vision without being dilated at first, get the prescription, put it into the computer. Then I will dilate the eyes if it's necessary, depending on if they have hypertension, high cholesterol, family history of certain things. Check the interocular pressure to ensure that they don't have glaucoma.
Wow.
Do all of those things. Document it, of course, make drawings. We'll take photos. I'll take retinal photos of the back of the retina. A lot of times we'll do that even if there's not any problems because I want baseline information because things like glaucoma and diabetes and macular degeneration, they can develop in the
In the
future.
future.
So you've got to have that. I usually take a retinal photo almost on every patient,
Hmm.
keep that in the chart, and evaluate them for cataracts and do things like that. And if I'll go over everything with them in their plan and how to, I focus a lot on how to prevent their vision from getting worse, how to slow down the progression of nearsightedness in our children. I
Okay.
look at a lot of things, how to take the strain away. I'm discussing all of those things as well as concentrating on eye disease
Right.
and the health. I do those things. But if when there's a situation that I'm not comfortable with, say a person's diabetic retinopathy is really progressing, macular degeneration has gotten to the point where,
Hmm.
glasses and my services are not going to help them, and if they need surgery, and I can't I can't get them to see better with glasses, I'm going to refer them to
Okay.
a specific ophthalmologist,
Okay.
whether it be a retinal specialist for diabetic problems or a cataract surgeon. That's when the ophthalmologist comes into play.
Right.
We are considered primary eye care specialists.
Specialist.
We are
Right.
considered a physician. However, we do primary care. But when it gets to the point where a person needs surgery, I'm going to
Send them.
refer.
So the
Yes.
ophthalmologist is the one who does the surgery.
Yes.
So who do you work with in terms of the Northeast? I know it's full of ophthalmologists. So who do you mostly refer to? Shreveport,
I
Monroe,
do refer a lot to the Willis Knight Eye
Willis
Institute.
Knight Eye.
I have a very good working relationship with those doctors. I mean,
Okay.
but here in Monroe as well,
Okay.
there's many.
Of
Um,
course.
but I primarily
Right.
send them
Now,
to
I
Willis
know
Knight.
as a doctor, we have a lot of hospitals trying to buy up doctor practices. Is that happening in optometry too?
I would tell you that I believe that's going to happen. I do believe that is happening and trying to open up little satellite clinics. However, right now, I mean, we're doing fantastic, and
Wow.
I am practicing full scope optometry
You
and
don't want to
service.
sell.
I do not, and that is something
That's
I have a
awesome,
really
right?
great thing going,
Hmm.
and I know my place, and I know that if I'm not comfortable with a patient or how they're going, I'm going to send them to the
Of
surgeons,
course.
and even in those situations, a lot of times those little satellite clinics are not going to be able to provide
Hmm.
everything.
That those patients need.
Yes, that
I'm
those
just
patients
curious, when
need.
you see your classmates from Louisiana Tech, are they like, wow, we didn't know you could become how, I mean, do they say that to you? Because, at times in medical school, I know this for a fact. I had a professor tell me the best student in my class was a lady. This professor of cardiothoracic surgery came up to our class, stood he stood on the podium and said, I know the best student in this class is a female, but she's not going to get anywhere because she's a woman. She's going to get pregnant, she's going to have kids, she's not going to pursue her career, she's going to be a housewife. And then he pointed to us, the guys, and said, you are the ones going to make this university famous. I know she's the top of the class right now, but 10, 20 years from now, the men are the people we're going to be remembering. Is that true from your tech class? Is that
Oh, yes, very much. I had a professor that pretty much told me the exact same thing and he just tried to close all the doors and all my dreams and would say things to me, and it really hurt. It did, but in my mind and in my heart, I didn't
hmm
let the devil
right?
take control of my thoughts, and I said, no, I'll show you one day.
Okay.
I'll show you one day, and I will definitely do that. I'd always been a hard worker. Most all of my professors, even today,
Wow.
will come see me, and they'll
Okay.
say, we knew you were going to be successful, but there was that one. There was that one. And I said, yes, we all know that one.
But what would you tell those women watching today who think it's impossible for a woman to succeed in an independent business in this part of the country? They say, well, you can do that in New York, but not in Louisiana. Louisiana is a redneck, male
Oh,
dominated. They call it, I don't want to use such horrible words, but um, they kind of feel the male has a way they operate that dominates the status quo and the stratosphere. So what would you say to that female who feels there's no opportunity because I'm a woman? I mean, you've done it,
um,
you've seen it, and you've succeeded. So what would you tell her to get her to pursue her dreams and not give up on her God-given destiny?
okay, I don't want to digress, but I want to tell you the story.
Sure.
I want to tell you this because this is important this is relevant. Because don't give up. Don't give up and follow your heart. That would be the biggest thing. Follow your heart and just know. And if you have a relationship with Jesus Christ, you're going to know. You're going to
Hmm.
know. You just know that that is what you're meant to do,
Right.
and what your purpose is. And as long as you're honest with yourself and the Lord, you're going to know. And don't give up, because He will still give you those opportunities again and again. It's going
Hmm.
to keep showing up. And when I was back in Arcadia and I had graduated, I wanted to be in the Lions Club.
Oh,
Okay, and I'm going to use these words. This is a good old boy system. This is a good old boy area. That's what I was told. And we're not going to have a woman coming in to the Lions Club.
Oh, really?
Hmm.
Lions Club is
Lions
for
Club.
both sexes, really.
Yes, yes.
Okay.
However, I was the first female allowed to be in the Arcadia Lions Club.
Wow.
And I'm going to tell you why. There were men in that room that knew what I could do and knew that I could help and knew that I would work and be able to offer. But there were others that were like, no women.
We've never had a
No,
woman.
we've never had a woman. We're not going to do that. But they did. And I was
Wow.
actually the first woman to be
To be in
inducted
that club.
and to the Arcadia Lions
Yeah.
Club.
Lions Club, I know they do a lot of
Hi.
like I see them do a lot of agriculture, horticultural, planting flowers, and they also educate people. They help
Yes.
the society, the environment, right?
Yes, and they actually have the Louisiana Eye Foundation. And
Okay.
so, which was very interesting to me, and that
Wow.
was how I can contribute. And they do screenings in the school with the Louisiana Eye Foundation, and then those kids can get referred to certain doctors, and I
My
am on that
goodness.
panel to be able
I
to
know,
evaluate
right?
them.
Wow. So don't give up. You heard that from
Don't give
Dr. Jennifer
up.
Floyd. Don't give up. I mean, you could be the first female American billionaire. I mean, I know there's already a few, but maybe the first female American billionaire from Louisiana. Don't say I'm a woman. That's why I can't become who God has called me to be. When God made you, he made you complete. The Bible says that you are complete in Him. And when you don't need a man to complete you. You're already complete. A man just complements what God has finished in you. Okay, you're not trying to make a man complete you. That's a mistake a lot of women make. They say, "Oh, I have to get married to be complete." No, the Bible says that you and I, we are complete in Jesus. So you have everything you need within you in Jesus to be a success story. So give us a few ideas about optometry. There's this thing they call the Google Eye. What happened with that? There was supposed to be a new set of glasses that you could touch, and I think you could see stuff better. What happened to that? It fizzled out or
It
so?
did. And I want to be honest, that technology never came into my practice.
Okay.
There was a few people that tried it where you would touch, but I just don't know whatever really came of that.
Came out of
When
that.
they did present it to me, there was just so many glitches, I would say. But I really don't know all of
All
them.
about it,
I
right?
don't, because it was kind of just it fizzled
New
away
thing,
very
right.
very
So
quickly.
you do a lot of cataracts. I mean, not cataracts, contacts.
I do a lot of contacts. I
Okay.
do. I wear contacts. I actually never had LASIK surgery. I
Wow.
could, but there's a story to that, of course.
Okay.
And I, if you have children, you can't have laser surgery. And I honestly kept having children. Every opportunity that I had, I would have a child. And so it was I just never did it. But I do refer out for
Okay.
laser surgery. But contacts, I wear contacts, and then I look at that as also a blessing because I am putting contacts in my eyes almost every day.
Mm.
I get to know the material, what's best for the patient. I looked at it, I was like, oh man, I should have had laser surgery back.
Mm-hmm.
But I now, nope.
Wow.
I know that I am providing the best care. I'm getting to try the lenses, and I know what I recommend. I know how they feel. A lot of the reps will come in and they'll say, this is the best product. This is the newest thing. Okay,
Right.
great. Let me try it, and I'll get
And
back
then
with
I'll
you.
get back.
Yes, and so I.
And what happened to the depth perception? You never told us the end of the story.
Yes. Okay. So I have very little depth perception, but when I was at the optometrist that day, he said you needed vision therapy,
Oh.
and I said, well, what's that? He said, well, there's nobody here in Louisiana, especially North Louisiana, that does vision therapy. And he said, you have that option, or you could go have surgery. And you'd have to go to Shreveport and have surgery. Well, my mother said, absolutely not. We are not doing surgery on the eyes. That's not going to happen. And that really upset me because if that's the quick fix, let's
Right.
do that. I really need my eyes. I want to be a surgeon. I want to do that. But then there was no guarantee.
Wow.
My left eye turns in and it crosses.
Mm.
And so the option was to have vision therapy. So I
Wow.
wanted to learn more about vision therapy. And that was one of the things that I actually decided, the reason why I decided to go to Southern College of Optometry in Memphis was because they have a program that has a greater emphasis on strabismus and eye turns and learning
Wow.
related vision disorders, and they focus more on that. So when I got into school, actually my condition is very rare,
Mm.
and it's like less than 6% have this problem and that I have, and I was literally the demonstration of what could be
Wow.
wrong with the muscles of the eye, and I just learned so much through that,
To
and I
that.
started doing vision therapy
Wow.
and improved over time, and I
Wow.
actually was able to reduce my prescription in my glasses and my
Wow.
contact lenses. So I was actually very glad that I never had LASIK as well,
Mm-hmm.
because I knew that there are exercises that you can do to
Do.
strengthen the eyes and to lessen your prescriptions.
And that made you give first-hand information to your patients who may have
Absolutely.
needed LASIK.
And
Tell us how you handle your apart from the work, apart from home, apart from the church, you have a social life. What are your hobbies, your passions, and I mean, do you have social gatherings you attend? What are your pastimes? How do you relax? And you know, who do you hang out with outside work, church, and home?
well, there's not a lot of time. There's not a lot of time for that, but I do have some close friends,
Okay.
and I like to garden,
Okay.
and the flowers. I like doing that, but I don't get to do that a lot. I like to exercise.
Okay.
Have to get rid of the stress somehow.
Right.
And I do cook sometimes,
Okay.
and try to do new things.
Wow.
But I don't have a lot. I spend a lot of time with my patients,
Mm-hmm.
and out in the community.
Okay.
I do, and so that's like a hobby to me. My
Okay.
job is not like work. I must
Right.
say that it's not
Wow.
like work. I really love my job. I really like caring for people. I try to provide good service. I think those are all things that are missing.
Mm-hmm.
It's not like it used to be.
Mm-hmm.
And
And when I was going to Africa on a missions trip, I reached out to Dr. Floyd, and she sent me a ton of glasses to take to the people of Africa, and they're still talking about it today. I think that was maybe 2014 or so, and they love those glasses, and that's community outreach. That's
yes,
you're sending a seed to people in Africa, hundreds of thousands of miles away, letting them know that Jesus loves them. That those glasses you sent could have been the difference for a child who could not read and somebody who could read. So that's a difference you're making,
thank you.
So we've been talking to Dr. Jennifer Floyd. She's an entrepreneurial optometrist. She's been showing us, especially the young women in our on our screen, the example they can live up to. It's possible to become a success. It's possible to break through that so-called glass ceiling that they've told you that you could not go through. It's possible to own your own business and still remain a Christian. Dr. Floyd has shown that it's possible, and she's going to continue sharing her story, her testimony with you on the next show. You don't want to miss it. Look forward to seeing you. This is Dr. Toby and Dr. Jennifer Floyd telling you Jesus is Lord. See you next week. God bless you. Awesome.